Hi, my name is Madeline Plord. I'm a general surgery resident from Halifax, Nova Scotia, Canada. My study was to look at the yield of the first surveillance colonoscopy following curative resection for colorectal cancer. The purpose of our study was to see that prolonging the time from the first surveillance colonoscopy from 1 year to 3 years. And to show this, we first looked at the timing of the first surveillance colonoscopy. So we looked at 414 patients, and 46% of them underwent colonoscopy within 1 year of their surgery. We found that 47% underwent surveillance between 1 and 3 years. We then looked at the rate of advanced neoplasia at the first surveillance colonoscopy and divided that between the 3 times. So for patients who had their surveillance within 1 year, their rate of advanced neoplasia was higher than patients who had their surveillance between 1 to 3 years. So this led us to believe that these were most likely missynchronous cancers and not truly metachronous cancers, because the adenoma carcinoma sequence that leads to colorectal cancer takes about 5 to 10 years to develop. So we then looked at the rate of advanced neoplasia with regards to timing of assessment and compared that to the preoperative colon assessment. So we saw that patients who underwent a complete preoperative colonoscopy had fewer advanced neoplasias at surveillance than patients who underwent either a barium enema or an incomplete colonoscopy with barium enema. So this was then confirmed by looking at the number of polypectomies which were done preoperatively on the first colonoscopy, and we found that patients who had a complete colonoscopy had a much higher rate of polypectomies than the patients who had incomplete colonoscopy and barium enema. So this supports our argument that these are most likely missed synchronous lesions and not metachronous lesions. So our conclusion was that if you've undergone a complete preoperative colonoscopy, that your first surveillance colonoscopy can wait up until 3 years following surgery. And the reason that we think this is important is that this allows more resources for screening colonoscopies. Now, we do realize that some patients cannot have adequate preoperative colon assessment, and we still enforce that these patients should have early postoperative colonoscopy, ideally within 6 months of surgery.